I would say that myeloma is really at the forefront of MRD diagnostics in hematology. This is not something that has started last year or 2 years ago. It's really a 20-year process, but it's coming now of age. And in this ASH we have at least 3 oral presentations really focusing on MRD. One from the French group using next-generation sequencing on the IFM 2009 study. This is the final analysis of the value of MRD assessment in that clinical trial, which we already know it's of great clinical value. Then we have a second abstract from the UK group in which MRD by flow cytometry, an older flow cytometry method, still with good value, analyzing the interaction between MRD and maintenance therapy. In other words, how maintenance is able to eradicate MRD in some patients, and these patients do extremely well. Then the third study is coming from the Spanish myeloma group on the clinical trial I alluded before, in which we are seeing that with next generation flow you can really perform MRD in virtually all patients. This is, we believe, at the moment the largest study with MRD, with over 1,100 samples being assessed in this clinical trial. Next generation flow worked very well, reaching a limit of detection, a median limit of detection of 3 per 10 to the minus 6, so highly sensitive. And the results with the current follow-up that we have, which is still, well, not yet fully mature, I would say that the results are very promising. For patients with a positive MRD result at the end of the study, the median progression-free survival is approximately 14 months, whereas for patients that have reached an MRD negative result with a limit of detection of 10 to the minus 6, risk of relapse is extremely low at the moment. Only 6 patients have relapsed so far. This is 3%, and the median PFS naturally has not yet been reached. Another interesting finding, well, there are 2 interesting findings of this, 2 additional interesting findings of the study. One is the impact in progression-free survival of achieving an MRD negative result among patients with high-risk cytogenetics, and we are seeing that these patients have a PFS that is superimposable as compared to the PFS of patients with standard risk FISH also achieving an MRD negative result. In other words, MRD as the endpoint for high-risk myeloma patients. If you want these patients to have the same outcome as all the other interesting finding, and this is still preliminary because again the number of patients that have relapsed with an MRD negative result is so low, but still there seems to be like a unifying event across these patients, which is the presence at diagnosis as well as the time of the relapse of bone-related plasmacytoma, which is a sort of a light form of extramedullary disease. So let's have our eyes on that in a way that extramedullary disease is something to be captured, particularly to prevent possibility of relapses among MRD negative patients, and it emphasizes the need for combining cellular techniques, either NGF or NGS, plus imaging techniques such as PET-CT.